Joe started drinking alcohol with his high school friends. His father was an alcoholic and died of liver disease. His mother was taking care of him and his two younger brothers. Started for fun with friends. Joe is now consuming alcohol every day. He got a job after his studies. He did nothing but spend his salary in drinking with friends. Often go home late at night, heavy drunk, angrily shouting at everybody and throwing things inside the house. Once he passed out and was taken to hospital and he got admitted. Joe was diagnosed with alcohol use disorder. It is a type of substance use disorder. Earlier, it was called substance abuse or substance dependence. It occurs when the recurrent use of alcohol or any drugs causes clinically and functionally significant impairment such as health problems, disability, and failure to meet major responsibilities at work, school, or home. Let's go through it in detail. Types. Patients are diagnosed with a specific type of disorder based on the primary substance that they misuse. However, many patients diagnosed with SUD, that is substance use disorder, misuse more than one kind of substance, also known as polysubstance use disorder. The major types are opioid use disorder, marijuana use disorder, nicotine use disorder, stimulant use disorder, sedative use disorder, hallucinogen use disorder, and alcohol use disorder. First is opioid use disorder. Opioids. They are naturally occurring, derived from the sap of the opium poppy plant. Morphine was isolated from opium. In an effort to alleviate the addictive nature of morphine, heroin was synthesized. Types. It includes the illegal drug heroin, synthetic opioids such as fentanyl, and prescription pain relievers. These drugs are chemically similar. How it works. It interacts with opioid receptors on nerve cells in the body and brain. Opioids are unique in that they provide both euphoria and drowsiness. Tolerance to these drugs builds quickly, thus resulting in an increased need of the medication to produce desired effects. How it affects. They are highly addictive in nature, including euphoria, particularly when they are taken at a higher than prescribed dose. Opioids can also produce drowsiness, confusion, nausea, constipation, and respiratory depression. Opioid withdrawal symptoms can range from restlessness, muscle pain, fatigue, anxiety, and insomnia. Unfortunately, these withdrawal symptoms as well as intense cravings for the drug can persist for several months, with some reports up to years. Marijuana use disorder. Marijuana refers to the dried leaves and flowers from the cannabis plant, which contains the mind-altering chemical delta-9 tetrahydrocannabinol, that is THC, and other related compounds. How is it used? Marijuana can be smoked, vaporized, eaten, and brewed in tea. Other common names for marijuana are weed, pod, and cannabis. How it works. When marijuana is smoked, THC quickly passes from the lungs to the bloodstream, which carries it to the brain and other organs. The body absorbs THC more slowly when the plant is eaten. THC affects brain receptors that ordinarily react to natural THC-like chemicals that play a role in normal brain development and function. Marijuana overactivates parts of the brain that contain the highest number of these receptors, which causes the high that people feel. How it affects? It alters the senses. For example, seeing brighter colors. Alter the sense of time. Changes in mood. Difficulty with attention and problem solving. Impaired memory. Increased heart rate. And rare side effects that can occur when THC is taken at very high doses include hallucinations, delusions, and psychosis. Nicotine use disorder. Nicotine. Tobacco is a plant grown for its leaves, which are dried and fermented before being used in tobacco products. Tobacco contains nicotine, an addictive ingredient. How is it used? Tobacco can be smoked, vaporized, chewed, or sniffed. How it works? When tobacco is smoked, nicotine rapidly reaches peak level in the bloodstream and enters the brain. When tobacco is not inhaled in products such as cigars, pipes, and smokeless tobacco, nicotine is absorbed through mucous membrane and reaches peak levels more slowly. Nicotine stimulates the adrenal glands, which results in the discharge of adrenaline. How it affects? The rush of this adrenaline stimulates the body and causes an increase in blood pressure, breathing, and heart rate. Cigarette smoking harms nearly every organ in the body with wide-ranging health impacts from cataracts to pneumonia. And it accounts for about 1/3 of all cancer deaths and almost 90% of all cases of lung cancer. Smoking is also associated with cancers of the mouth, pharynx, larynx, esophagus, stomach, pancreas, cervix, kidney, bladder, and acute myeloid leukemia. Pregnant women who smoke cigarettes incur an increased risk of miscarriage, stillborn or premature infants, or infants with low birth weight. Secondhand smoke exposure can cause health problems in both adults and children, such as reduced lung function, pneumonia, and bronchitis. Stimulant use disorder. Stimulants include a wide range of drugs such as cocaine, methamphetamine, and prescription medications. Historically, stimulants were used to treat asthma and other respiratory problems, obesity, neurological disorders, and other ailments. Now, stimulants are prescribed to treat only a few health conditions including ADHD, narcolepsy, and occasionally depression. Cocaine is a chemical isolated from the South American coca plant. Methamphetamine usually takes the form of a white bitter tasting powder or a pill. How is it used? Both methamphetamine and cocaine come in different forms and can be injected, snorted, swallowed, or smoked. The duration and intensity of the drug depends upon how it is administered. Certain methods such as smoking and injection put the substance into the bloodstream very quickly, thus increasing its addictive potential and the likelihood of overdose and other health consequences. How it works? All stimulants work by increasing dopamine levels in the brain. Dopamine is a neurotransmitter associated with pleasure, movement, and attention. The therapeutic effect of the stimulants is achieved by slow and steady increase of dopamine, which are similar to the way dopamine is naturally produced in the brain. How it affects? Stimulant misuse can include increased activity and talkativeness and decreased appetite and Need for sleep. Large amounts can cause erratic and sometimes violent behavior. Some of the most frequent medical complications associated with the stimulant misuse are cardiovascular effects, including disturbances in the heart rhythm and heart attacks, neurological effects, including headaches, seizures, strokes, and coma, and gastrointestinal complications, including abdominal pain and nausea. Combining cocaine with other drugs such as heroin or alcohol can be dangerous. Sedative use disorder. Sedatives, including tranquilizers and hypnotics, are substances that can slow brain activity. They are often prescribed to treat anxiety and sleep disorder. How is it used? Used as prescription medicine. Commonly prescribed sedatives include benzodiazepines and non-benzodiazepine. Then barbiturates. How it works. Sedatives suppress heart rate and breathing. During the first few days of taking depressant, a person usually feels sleepy and uncoordinated. But as the body develops a tolerance for the substance, these side effects begin to disappear. How it affects. Effects can include drowsiness, slurred speech, poor concentration, confusion, dizziness, problem with movement and memory, lowered blood pressure and slowed breathing. Combining sedatives with other depressants such as alcohol and opioids further slows heart rate and breathing, which can lead to overdose and death. Because all sedatives work by slowing the brain's activity, when an individual stops taking them, there can be a rebound effect, resulting in life-threatening complications such as seizures. Hallucinogen use disorder. Hallucinogens are diverse group of drugs that alter perception, thoughts, and feelings. They cause hallucinations, sensations, sounds, and images that seem real though they are not. Hallucinogens can be found in some plants and mushrooms or can be made in laboratories. Experiences brought by hallucinogen use are commonly called trips. How is it used? Hallucinogens are used in a wide variety of ways, including smoking, snorting, and absorbing through the lining in the mouth. How it works. Hallucinogens temporarily disrupt chemical communications throughout the brain and spinal cord. Some hallucinogens interfere with actions of the brain chemical serotonin, which regulates mood, sensory perception, sleep, hunger, body temperature, sexual behavior, and muscle control. Other hallucinogens interfere with the brain chemical glutamate, which regulates pain perception, responses to the environment, emotion, learning, and memory, among other functions. How it affects. Increased heart rate, nausea, intensified feelings and sensory experiences, changes in sense of time, for example, the sensation of time passing by abnormally slowly, increased blood pressure, breathing rate or body temperature, then loss of appetite, dry mouth, sleep problems, mixed senses such as seeing sounds or hearing colors, then spiritual experiences, feelings of relaxation or detachment from environment, uncoordinated movements, excessive sweating, panic, paranoia, that is extreme and unreasonable distrust of others, then psychosis, that is disordered thinking and detached from reality. Alcohol use disorder. Alcohol is one of the most commonly consumed intoxicating substances and legal in most parts of the world. Alcohol is formed when yeast breaks down the sugar in certain foods such as grapes, barley, and potatoes through a process called fermentation. Alcohol is the active ingredient in drinks such as beer, wine, and hard liquor. How is it used? It is consumed as a beverage. How it works. The active substance of the alcohol is ethyl alcohol. It is a chemical that is absorbed quickly into the blood via the lining of the stomach and intestine. Once in the bloodstream, ethyl alcohol travels to the central nervous system, that is the brain and spinal cord, and produces depressive symptoms such as impaired reaction time, disorientation, and slurred speech. These symptoms are produced due to the ethyl alcohol binding to the GABA receptors, thus preventing GABA from providing inhibitory messages and allowing the individual to relax. How it affects. Blurred vision, difficulty walking, slurred speech, slowed reaction time, and sometimes aggressive behaviors are observed. Severe alcohol use disorder, also known as addiction, is a chronic relapsing brain disease characterized by compulsive alcohol use, loss of control over alcohol intake, and a negative emotional state when not drinking. Drinking too much over a long period of time can also take a serious toll on the person's physical health. Heavy drinking can damage the heart, liver, pancreas, weaken the immune system, and increase the person's risk of developing certain cancers. Next is gambling disorder. Gambling refers to an activity in which a person risks something valuable to them in order to win something in return. Common forms of gambling include betting in casinos or on sporting events. Gambling disorder. It describes loss of control of gambling behavior that causes significant problems with finances, work, or personal relationship. Gambling disorder recognized by the DSM-5 as a behavioral addiction. Comorbidity. It is highly comorbid with other mental health disorders, particularly substance use disorders. Scientific evidence shows that gambling and substance use disorder have consistently high rates of comorbidity, similar clinical presentations, and some genetic and physiological overlap. Causes. There is no known cause for this disorder. In some cases, the condition runs in families. Symptoms. Problem gambling is typically marked by constant thoughts about gambling, only thinking about gambling, continually gambling despite consequences, failed attempts to stop or cut down the gambling behaviors. Causes. Biological. Genetics. Similar to other mental health disorder, substance abuse is genetically influenced. Biologically, the individual may be genetically predisposed to substance abuse. Additionally, the individual may also be at risk due to their familial environment where their parents or siblings are also engaging in substance abuse. Individuals whose parents abuse substance may have a greater opportunity to ingest substances, thus promoting drug-seeking behavior. Furthermore, families with a history of substance abuse may have more accepting attitude of drug use than families with no history of substance abuse. Neurobiological. A long-standing belief about how drug abuse begins and is maintained in the brain reward system. A reward can be defined as any event that increases the likelihood of a response and has a pleasurable effect. Cognitive. Regarding the anticipated effects of the substance use. Those with alcohol abuse reported expectations of tension reduction, enhanced sexual experience, and improved social pleasure. Behavioral. Positive reinforcement occurs when substance use is increased due to the positive or pleasurable experience of the substance. Negative reinforcement. Many people ingest a substance as an escape from their unpleasant life. Withdrawal from a substance often produces significant negative symptoms such as nausea, vomiting, uncontrollable shaking, etc. To eliminate these symptoms, an individual will consume more of the substance, thus again escaping the negative symptoms and enjoying the highs of the substance. Sociocultural. Sociocultural causes of the substance-related and addictive disorder include friends and immediate environment. Diagnosis. Tests. Blood, urine, or other lab tests are used to assess drug use. These tests may be used for monitoring, treatment, and recovery. Assessment. Diagnosing the substance use disorder requires a thorough evaluation and often includes an assessment by a psychiatrist, a psychologist, or a licensed alcohol and drug counselor. Use of DSM-5 criteria. Mental health professionals use criteria in DSM-5. The diagnosis of a substance use disorder is based upon a pathological set of behavior related to the use of that substance. These behavior fall into four main categories: impaired control, social impairment, risky use, and pharmacological indicators. It is the tolerance and the withdrawal. A person needs to meet at least two of these criteria to be diagnosed with a substance use disorder. The severity of addiction is determined by the number of criteria met. Management. Biological treatment. It includes detoxification programs, that is gradually decreasing the amount of substance until the individual is off the drug completely, or eliminate the substance entirely while providing additional medications to manage withdrawal symptoms. Agonist drugs. These provide the individual with a safe drug that has a similar chemical makeup to the addicted drug. Antagonist drugs. Antagonist drugs block or change the effects of the addictive drug. Behavioral treatment. It includes aversion therapy and contingency management. Aversion therapy is based on classical conditioning principle. Aversion therapy is a form of treatment for substance abuse that pairs the stimulus with some type of negative or aversive stimulus. Contingency management. The patients are rewarded with vouchers or prizes in exchange for abstinence from substance use. Cognitive behavioral treatment. It includes relapse prevention training, identifying potentially high-risk situations for relapse, and then learning behavioral skills and cognitive interventions to prevent the occurrence of a relapse. Socio-cultural treatment. It includes Alcoholics Anonymous, AA. The goal of Alcoholics Anonymous is abstinence from alcohol. Residential treatment centers. Individuals are completely removed from their environment and live, work, and socialize within a drug-free community, while also attending regular individual, group, and family therapy. Community reinforcement. The immediate community, that is family and friends around the patient, reinforces the positive choices of abstaining from substance use. Hope you like this video about substance related and addictive disorder. Please subscribe the channel for more videos on related content. Thank you and keep smiling.